All right, so for my second lower extremity orthopedic exam, I'm going to do the Thompson test, which is assessing for the Achilles tendon, essentially the Achilles tendon rupture or tendonitis, depending on what they come in with. So the patient will come in with pain along the tendon, which runs from the back of the lower leg right here in the gastrocnemius and the calcaneus bone. They'll say there's pain right in that tendon. They'll complain of it. And a typical patient is going to be athletes, anything along like track stars, people who start in a plantar flex position, football athletes, things like that, and then they have like forceful push off with their toes. That kind of push off in a plantar flex position could irritate that tendon or possibly rupture it, depending on whether it was already weakened or how much push off they actually did. I expect the calf muscle to be hypertonic in that guarding position, just protecting that end area. MRI would probably be the best imaging to assess whether or not that tendon is inflamed or completely or partially ruptured. Active range of motion would be decreased or non-existent depending on if they have a partial tear or a complete tear. Passive range of motion would probably be increased because they wouldn't have really, if they completely tore, they would not be able to plantar flex or dorsiflex with that tendon completely ruptured. And then resisted would be painful, so I would expect a decrease in that also. No change in MRS, just because it's a tendon problem. And so Thompson test is performed with the patient prone position. They're going to have a flexed knee like this, and essentially all you're going to do is you just squeeze that calf, and their foot should go into a plantar flexion position, and that indicates that the Achilles tendon is intact, or if it doesn't go into plantar flexion, then it is ruptured. And that is Thompson's test.